New tonight. You know what to do when a product is recalled. You return it to the store. Maybe you get it fixed if you can. But what happens when a part of your body has been recalled? You can't take that back. So what can you do? Tonight, one woman wants an answer to that tough question.
We're going to go for a walk?
Taking the dog for a walk is something Mary Ellen Labita used to take for granted.
This way.
Until 3 years ago when her right hip gave out and had to be replaced.
It was very hard. You have to learn how to walk again. It's painful. Very painful.
At 41 years old, the mother of two thought surgery would make things better, but her pain only got worse.
I kept saying to the doctor, okay, when is this pain going to go away? When is it supposed to feel normal again? And finally, I got a phone call saying, guess what? This is recalled.
That's right. The artificial joint implanted in Mary Ellen's body had been recalled. Its makers, DePuy Orthopedics, recalled the ASR hip system in August because it was wearing out faster than they expected.
We really don't know what the fix is.
But Atlanta attorney Richard Schlueter, who's representing about 30 Metro Atlantans with the defective hip, says DePuy downplayed side effects that are far more serious.
They started seeing something that's commonly referred to as metallosis.
As this device wears, it can shed metal particles and cause swelling, pain, and permanent tissue damage. Schlueter says one particular metal is a real cause for concern.
It's the cobalt, it's the cobalt, it's the cobalt.
Can you say for me?
Dr. Caroline Abruzzi says our bodies need cobalt, but there is such a thing as too much.
When levels are elevated, we're not sure of all the effects, but some of them may be harmful.
Cobalt levels below 1 part per billion are considered normal. Levels above 5 parts per billion are highly toxic.
And mine are 9.9. So to me, that's dangerously high.
The patients that we're seeing are having anywhere from 20, 30, 40 levels, parts per billion.
Abruzzi says some people can tolerate high levels of cobalt, but others, especially those with diabetes or impaired kidney function, may experience big problems.
It can affect the heart and cause symptoms like chest pain or shortness of breath. It can affect the kidneys.
Other potential problems include ringing in the ears, called tinnitus, visual changes, and even weakness or numbness in your hands and feet. Some of these symptoms may be reversible, but for some people, like Mary Ellen, getting back to normal will require another painful surgery.
Knowing that what I have to go through, I'm mad. I shouldn't have to go through this. You get it done once, you trust that, they're putting the right device in you, and then this happens.
If you have the ASR hip system, ask your primary care physician to check your cobalt and your chromium levels, even if you aren't experiencing any symptoms. DePuy refused to answer our tough questions on camera. They did issue a statement. Go to our website, cbsatlanta.com, and click on the link under local headlines if you'd like to read it. We've also posted a link to DePuy's website and a phone number you can call with your questions.